Welcome to our video on how to stop severe bleeding. This is a critical skill that every caregiver should master, as knowing how to act in such situations can mean the difference between life and death. Today, we'll go through a step-by-step guide on how to identify severe bleeding, the necessary actions to take, and how to use first aid tools effectively. Let's dive in. First, let's understand why this topic is so important. Severe bleeding, if uncontrolled, can result in shock or even death in a matter of minutes. As caregivers, we often encounter individuals who may be more vulnerable to injuries or medical conditions that lead to significant blood loss. Knowing how to act promptly and effectively can save lives and reduce complications. Now let's talk about how to recognize severe bleeding. Look for signs like blood spurting from the wound, which often indicates arterial bleeding. Another clue is when the blood continues to flow despite applying pressure. Additionally, watch for signs of shock, such as pale or clammy skin, dizziness, or confusion. Lastly, large amounts of blood pooling or soaking through clothing are clear indicators of severe bleeding. Recognizing these signs early is crucial for effective intervention. In any emergency, your safety is paramount. Start by ensuring the environment is safe and wear gloves if available to protect yourself and the injured person from potential infections. Next, call emergency services right away. Time is of the essence. Lay the person down to reduce the risk of fainting and help them stay calm. Then, apply direct pressure to the wound using a clean cloth, gauze, or bandage to slow the bleeding. These steps are the foundation of effective first aid. Once you've applied direct pressure, it's time to secure the dressing properly. Always aim to use a sterile dressing or a clean cloth. If the bleeding continues, don't remove the original dressing, simply layer additional material on top. Removing the first layer can disrupt clotting and worsen the bleeding. Secure everything firmly with a bandage to maintain consistent pressure. Remember to keep monitoring the wound to ensure the bleeding has slowed or stopped. In some cases, especially with severe limb injuries, applying a tourniquet might be necessary. Only use a tourniquet when direct pressure fails to control bleeding. Ensure that you are wearing gloves to minimize the risk of infection while handling blood. Position the tourniquet about 2 to 3 inches above the wound, ensuring it is not placed over a joint. Tighten it until the bleeding stops completely, and document the time of application. This information is critical for medical professionals assessing and treating the injury. Remember, a tourniquet should not be loosened or removed unless directed by a medical professional. Be vigilant for signs of discomfort or potential tissue damage. Using a tourniquet can be life-saving, but it requires precision and care. Severe bleeding often leads to a condition known as shock, which occurs when the body is unable to circulate enough blood to vital organs. Recognizing shock early is critical for effective management. Watch for signs like a rapid heartbeat, shallow or irregular breathing, pale or clammy skin, and signs of confusion or restlessness. Once you suspect shock, lay the person flat on their back. If no spinal injury is suspected, elevate their legs about 12 inches to help improve blood flow to vital organs. It's also essential to keep them warm. Use a blanket or any available covering to maintain their body temperature, as shock can cause a dangerous drop in body heat. Reassure the person to help keep them calm. Reducing their anxiety can prevent their condition from worsening. Keep a close watch on their breathing and responsiveness. If you notice any decline in their condition, relay this information immediately to emergency responders when they arrive. By staying vigilant and supportive, you play a crucial role in managing shock and ensuring the best outcome for the individual. Thank you for your attention to this informational video. Remember, severe bleeding requires quick recognition and immediate action. Always ensure your safety, call for help, and apply firm pressure to the wound. If necessary, use a tourniquet as a last resort and manage the person's condition to prevent shock. Your swift and effective response can save a life. Your role as caregivers is vital, and your ability to handle emergencies like severe bleeding makes a huge difference. If you have any questions or need further clarification, please feel free to ask. Let's ensure we're all prepared to provide exceptional care in any situation.